All right, welcome everyone. Good afternoon. Happy 2025. Thank you for joining the first learning event of the year for the Chicagoland Healthcare Workforce Collaborative. This is our employer information session on WIOA funds, on the Chicago Cook Workforce Partnership, and the Healthcare Sector Center. The session is designed for employers, but we have many other types of partners on the call, and you are most welcome. We do have lots of different types of registrants, so I'm asking everyone, please introduce yourself in the chat and share one thing that you are hoping to gain from today's session. We are recording, and I will upload this recording to YouTube and that link to our website tomorrow. I will also include the slide deck there, so you can find that on our website tomorrow. I will also probably email it to everyone who's registered today. So don't worry if you're missing anything. For anyone who has not been to a Chicagoland Healthcare Workforce Collaborative meeting, thank you for joining us. We are an employer-led sector partnership that brings together employers and our industry partners, including training providers, community organizations, funders like the partnership, and others, to support a stronger, more inclusive healthcare workforce. We are primarily a peer learning collaborative, so we come together to share insights like we are today on how to fund projects, share best practices, learn about models that might be happening elsewhere in the country, and opportunities to partner. We focus all of our peer learning in three strategic pillars: local and targeted hiring, bridging the gap between our education providers and our employers, and retention and career pathways. So making sure that we're not just bringing people into the front line in healthcare, but that we are offering accessible, supportive opportunities to advance. Like I said, we're an industry-led sector partnership, but we are supported by all kinds of strategic partners. Here are some of the employers that are active in our table, some of which sit at our steering committee. And before I hand it off to our presenters today, I want to share a few of our upcoming events. We have a lot at the beginning of this year, so I hope to see you all again soon. Oops. I'm trying to access my links so I can put them in the chat for you. First, we have another one in our series called Career Pathway Programs Across the Nation. This brings some partnerships and models from elsewhere in other regions and highlights what they're doing, what's working, what's not, so you can learn from their best practices. It also highlights partners that you might be able to partner with. This one highlights Condensed Curriculum International that provides a whole suite of services in curriculum building and recruitment and pathway program management. That learning event will focus on their partnership with a couple of Boston hospitals who have been able to train hundreds of Boston residents and incumbent workers into occupations such as medical assisting, patient care tech, and surgical technology. So please join us for that. I just dropped the registration in the chat. Second one, I am very pleased that we'll be hosting the team from University of Illinois Chicago's Center for Healthy Work. They have done a multi-year research project with a mid-Atlantic healthcare system, looking at the health equity programs and initiatives that they've put in place for their employees at their system and asking, are these working? Are these actually helping our employees in the way that we intend? So they have a lot of interesting data to share. They're also hoping to continue similar work in the Chicago region. So you might have an opportunity to partner with them on some research. You won't want to miss learning about that. Then we have our quarterly meeting, our first quarterly meeting of the year, which will be virtual in March. Our June and September quarterly meetings will be in person, so you'll have in-person opportunities to network. But the first one will be in March on March 4th. The agenda is being tweaked right now, so I'll add that to our website and to the calendar invites in the next week or two. And then finally, we also have Public Health Workforce Collaborative members joining us today. Welcome. If you haven't been a part of the Public Health Workforce Collaborative and you'd like to, I will drop Anna Yankelev's email in the chat. She runs that table over at Health and Medicine Policy Research Group, and she can get you on the list to join those meetings. Finally, one final update or pitch is if you don't already receive them and you would like to receive our monthly CHWC newsletters, please sign up. There's a little box at the bottom of our website. That is where we announce all of these events. I often link recordings of past events, and there's a whole section of news and partnership opportunities that changes every month. So if you're not getting it already, please sign up for that. Now, without further ado, let me pass it off to the team at the Chicago Cook Workforce Partnership. Do we have Tanya with us? Yes, there you are, Tanya. I am making you a co-host, Tanya, if you would like to share your slides,
Oh,
or
thank
Michelle's
you.
sharing.
Michelle will be sharing. Yes, thank you. Thank you.
Wonderful. Take it away, Tanya. Tanya is a business relations specialist at the Chicago Cook Workforce Partnership.
Thank you, April. It's a pleasure to be here. I am Tanya Cody Robinson, Business Relations Specialist with the Chicago Cook Workforce Partnership, and we're here to speak about WIOA opportunities or funding opportunities through our American Job Centers and the Chicago Cook Workforce Partnership. Next slide, please. I'm Tanya Cody Robinson, Business Relations Specialist with the Chicago Cook Workforce Partnership, also a talent pipeline manager with the partnership as well. Hi, Michelle. Here's my contact information if you need to reach me either via email, over the phone, or by mobile, as well as Michelle McFarland. Her contact information is listed. She's the Deputy Project Director for Equus Workforce, who's our healthcare sector center. Also, we have Michelle's contact information, as well as her office number, as well as her mobile number. So use us as a resource. Do not be a stranger. We're here to assist you with all things business engagement. Next slide, please. For those of you all who do not know about the partnership is a large non-profit organization that operates the largest workforce center in this country. We're designated the federal administrator for the Workforce Development Funding with the City of Chicago and Cook County. We oversee approximately 70 community-based organizations, American Job Center, satellite offices, sector center strategies, as well as we oversee a large portfolio of initiatives from corporate and philanthropic leveraging funds for WIOA and non-WIOA funding. So more information, please visit us at shycookworks.org. And in terms of focusing on labor market information, here are the high sector areas that we focus on, which is business and professional services. We have an entire team within the business relations and economic development section, also healthcare, which Michelle McFarland is representing. We also have a retail, culinary, and hospitality sector. Many of you all know the 8th annual upcoming Hospitality Hire Chicago. There's a IT sector, manufacturing, transportation, logistics, and construction, and many more. We're also entering into the space of employment opportunities for doulas, for so many other, anything under community health, for agencies as well. So please use us as a resource. Next slide, please.
Okay, Tanya, I'll jump in here.
Thank you.
You're welcome. Thank you. So I just want to say again, good morning to everyone. I had put that in the chat. I recognize many names that we have partnered with and currently collaborating with as part of our partnership with the Healthcare Sector Center on behalf of the partnership. So nice to have you here. And for those who are not familiar, this is just a little bit about the partnership's Healthcare Sector Center. And so the Healthcare Sector Center is operated by Equus Workforce Solutions. So Equus Workforce Solutions is actually my employer. And on behalf of my employer, we operate the partnership's Healthcare Sector Center. And we have been doing so for the past almost 9 years now. And so we've established numerous collaborations with different hospital systems. Many of you are on this Lunch and Learn with us today. In addition to dental offices, there are federally qualified healthcare clinics that we work with, skilled nursing facilities, you name it. If it's healthcare, we have embraced and partnered with many of them over the years. And so what we do is we offer business workforce services to healthcare employers and employment placement services to individual. The Sector Center promotes the workforce system's business services. How do we do this? By delivering recruitment and retention services and partnering with you, employers, vocational training providers, community colleges, workforce community agencies to assist qualified, ready job candidates in helping them attain gainful employment. Our focus as a sector is centered on the employer to identify and create for you customized training plans and develop innovative work-based learning programs for current employees and new hires, utilizing Workforce Innovation Opportunity Act, also known as WIOA, through business service training reimbursements. And we are going to talk about those work-based learning programs as we proceed today. We wanted to share first, though, a system overview. And I'll ask Tanya to just guide us through a system overview.
Not a problem. In terms of our system overview, this is how all of our connected tissue come together. We're working with the employer, as Michelle mentioned. All of our initiatives are employer-led. We want to connect you with the job seekers. We're working diligently with our training providers. And then we also work with our business services team, along with our career coaches within the 70 designated community-based organizations throughout the community. Then this brings us all together as the workforce system. And then there should be one more click. Oops, I'm sorry. Okay, you can go back. And then we bring together the job postings, your candidate assessments, any upskilling issues or any training revisions that you would like to have done. We have our sector strategies that are taken into place there. We do a lot of data analytics, which is available in a lot of our outcome reporting within the partnership at a higher level for our elected, whether it's at the congressional level, the state level, and our local level. We work intentionally with our career coaches and our individual training plans so that we make sure that we're training so that our candidates will be successful in their job search and their career search. That takes us into career pathways, which it could be apprenticeship program or any of the business services that we will be speaking about, as well as creating a talent pipeline for upskilling for positions that are available now, as well as in the future. A lot of our work that we're doing in terms of healthcare, we're focus plan, we're doing the mapping, the backfilling, et cetera. We're looking at what's available today, even 5 and 10 years into the future. We're also working with our K through 12 partners so that we're making sure that curriculums are designed at a high school level, providing stackable credentials and dual enrollment so that our young people are not getting out of school and their training is aligning with their interests in terms of career pathways. So next slide, please. In terms of our regional labor market information, here are all of our high growth industries that was listed on one of the other slides. Again, business and professional services. That's all of your admin positions, that financial services is indicated within that sector. There's a whole plethora of positions that aligns within all of the sectors that are listed here. Then that goes into healthcare, which is the reason why we're here. Also retail, culinary, hospitality, IT, manufacturing, and so on. Next slide, please. Do you want to take this one?
Sure,
Okay.
I can take this slide. So this particular slide that we're looking at are employer business services that the healthcare sector for this particular session will offer to employers based on your needs and what you need in terms of pre-screening and matching qualified job applicants with your employer job orders. We amplify and augment HR teams by recruiting and accessing candidate skills and qualifications to identify potential hires for you. We advertise, we promote job listings and hiring events with all of those community partners and agencies within the network that you just saw on the previous slide. We organize virtual and in-person recruitment events, pre-screening and hiring events. And just an example of that would be an all-sector event that we had at a venue in November of last year, in which all the four sectors came together, including, of course, the healthcare sector center. And we had employers on site, and we identified individuals who would be good fit for the positions for the employers. We also do customized or virtual hiring events, which we have done in the past. So that is an opportunity still as well. So we have a partner that we work with at SIU, Illinois WorkNet. We have a partner that we work with where we can host for you, the employer, a virtual recruitment event. And what that would look like is a short presentation from, the employer yourselves about the opportunities you have, about your businesses. And then we have breakout rooms. So you could have, for example, a hiring manager or a recruitment individual speak to the attendees, the job seekers, about particular positions. So with this being said, we definitely can customize the recruitment events based upon your needs. And we have several models that we would work with in filling those needs for you. Again, we partner with vocational training providers. We monitor student job seeker referrals to ensure that they achieve training completion successfully. And so many of them, as you might know, in healthcare are earning credentials, such as the patient care technician, the medical assistant, the phlebotomy, et cetera. So it's very important that even, while they're working, of course, they have to have a livelihood in combination with going to school. It's very important, though, that their training is completed successfully. We collaborate with educational providers to support those healthcare students with their job search. And we conduct customized employer job readiness and resume assistant workshops in group settings or one-on-one. So that is definitely one of our key benefits and models that we offer to employers by working on partnering with individual employers. And many employers, again, are on this call. We are able to customize our job readiness sessions individually with individuals that we refer, or we can, again, do those in group settings. So those are some of the benefits that we offer to each employer, and we will assess you, talk about your needs, and then talk about a plan for how we can support you. So right now, what I'd like to get into is some of those business services that we talked about previously or highlighted. You may be familiar with OJT, in other words, on-the-job training. On-the-job training is where an employer agrees first to hire, then train, and then retain the individual upon successful completion. What we do is we help match you with qualified applicants for your jobs. We design an employer-based training plan. Part of the OJT will require documentation once the OJT takes place. Again, OJT, on-the-job training. So your piece as an employer would be providing employer records. We have a check-in just to ensure that everything was going successfully. And then a monetary reimbursement after that agreed training time period ended, and the employer would be reimbursed. But we'll go into a little deeper dive in just a moment. A second opportunity is paid work experience. And so paid work experience is for our WIOA youth, Workforce Innovation Opportunity Act youth, ages 18 to 24. It's a planned, structured learning experience for a limited time period, and that time period being about 6 to 8 weeks, almost up to 240 hours, if you will, to prepare that individual for an entry-level employment. Again, we match you with applicants that may be a good fit for the positions that you choose. You get to interview them. You get to say yay or nay. Do you have, someone else? Oh, I'd love to have this person be a paid work experience at my facility. We are then the employer of record, which means that we're paying that individual hourly during their paid work experience at your place of work. And it talks about, again, the 6 to 8 training weeks of training, and we'll go into that as well. A third business opportunity, service opportunity, is incumbent worker training. This is where employers receive reimbursement of the training costs for job-specific skills of your existing workforce staff. And one key note about incumbent worker training is that your employees do not have to be WIOA participants. It is still a work-based program. It is primarily to avert the need to lay off employees. It's capacity building within a company. It's upskilling your employees to move to another level, to earn more, to earn a credential or a certificate. And it's 100% employee-led training. And it's also 100% reimbursable. And we'll go into just a deeper dive with that. Apprenticeships. Apprenticeships are earn and learn models combining on-the-job training with instruction in curricula tied to the attainment of industry-recognized skills. And Tanya will take a little bit a deeper dive into that as we proceed. I do want to
Oh, go ahead, Michelle. I see that Connie has a question in reference to what are the age requirements for youth applicants who are qualified for paid work experience?
The age applicants, 18 to 24. So these would be individuals that are eligible and enrolled in the WIOA program, ages 18 to 24, and have been eligible under the title youth, ages 18 to 24.
Thank you, Michelle. And we have additional information towards the end that will give you more contact information about apprenticeship programs. But in a nutshell, what it does, it allows for apprenticeship programs to be registered with the U.S. Department of Labor. Typically, those training plans for your business will start off anywhere from 1 year to 2 years. Some can be longer, but typically they're from 1 to 2 years. In addition to that, across all of the sectors that was mentioned, there are stackable credentials as the training provider that we would build to keep that continuity of training and funding going on for the apprenticeship program, because we do want stackable credentials. We want to prepare to make sure that people are successful, not just to be hired, but we want them to be retained. And we want to know that those stackable credentials are industry recognized, whether if they're not with your business or if they decide to go to another business, they could still use that credential that was gained, whether it's with the community colleges or with our employers, where they can remain marketable and relevant within that space. Also, how all of our business services work for the apprenticeship programs, they're funded outside of what the employer will provide as their in-kind donation, but starting off with the paid work experience. The employer of record would be our American Job Center or our healthcare sector center in this case. We also have other agencies that could support if there are additional situations that is needed. Let's say if there's a 26-year-old youth, we also have other agencies that we could refer people to. Also, it typically starts off is at a paid work experience, where that person is pretty much being tested out for the position they're shadowing within that job. We're doing the works out agreement. We're making sure that all of the ducks are in a row and a training outline is outlined for that career awareness. Then it moves into the on-the-job training. That's the 4 to 6 month shared placement, the reimbursement that Michelle talked about, and we'll be able to go into more details. And that's the 4 to 6 months, which is providing additional stackable credentials. Before that ends, again, we want to keep that continuity of care. And if we know that this is a person that you want to continue on with your business, then we could roll out into the incumbent worker training. And that person, there's no income requirement for our incumbent worker to be WIOA eligible, because we're looking at upward mobility, retention, career advancement. That's taking us within that 1 to 2 year training period. So this is really about relationship building. It's really about robust career, community and economic development, whereas we're providing additional information to keep that person whole and to address the pain points of the employer. We're also addressing into other issues that may not be workforce related, but it's workforce impactful, whether it is child care or elder care, so that we can support our workers and our employer in that space so that we're not losing people due to those issues. Next slide, please. You want to take that?
Sure. And so this is where we're just going to get a little deeper dive into on-the-job training. But I do want to also support what Tanya said. At the end of the deck, you will see how you can actually turn this from the information sharing that we're doing today to actually connecting with us to go a deeper dive on any of these business services that we're talking through today. So there will be next steps shared with you there. But just thinking about on-the-job training, thinking about the candidate pipeline, if you will. We already talked about, or I spoke about that on-the-job training you can think of as you hire, we pay. So it's really offsetting the cost that you would pay for training an individual that meets basically all the essential qualifications for the position, but may not have worked in a pediatric unit, or perhaps they are a new graduate earning their credential and they don't have the experience that you're looking for, but for all intents and purposes, you would hire them. And so what WIOA does, what on-the-job training does, is it steps in and reimburses you for some of that cost. The candidate pipeline, it can be done through, again, that WIOA network that we spoke about earlier, where we pre-screen candidates to fill that position that you identify that you want to do an OJT for. Or there's employer reverse referrals. This is an opportunity where you have that job posting on your career website. If there's an opportunity for a hiring manager who wants to move forward and offer that position to that candidate that came internally through your career website, you could reverse refer them back to the healthcare center, for example, and then we would walk them through the process in terms of WIOA eligibility, because on the job training, the participant does have to be part of the WIOA program. We would take the steps to walk them through those next steps towards WIOA eligibility. And then once they are approved and eligible, we could move forward then with the steps to on-the-job training for your position. Enrollment into the WIOA program lead time is usually typically 2, maybe 3 weeks, probably 2 weeks. So I just wanted to add that as a caveat, because we do have hire first. However, we want to ensure that the individual that is being hired is part of the WIOA program first, initially, prior to the start of the first day of work. Just a list of steps that we go through once you are agreeable or you want to move forward with the on-the-job training. It includes a pre-award checklist. We provide that to you. The on-the-job training agreement. We talked about matching, supporting you with recruiting a qualified candidate for that position, which you would identify. We spoke about that can happen through us, again, recruiting or the reverse referrals. We create a training plan with your support. We check in once the on-the-job training is, proceeding and going on. When the on-the-job training time period ends, you sign up on the training plan, provide a work record, then we get started with the reimbursement, the monetary reimbursement package. And that reimbursement package and check could take like 30 to 45 days after the end of the on-the-job training period. What the monetary incentive, if you will, looks like in terms of the on-the-job training is for each participant up to $10,000 for each OJT participant that's hired, 6 months, or up to 1,040 hours. We have had partner employers that we've worked with reimbursements ranging from anywhere from $3,500 all the way up to $10,000. So it's not an anomaly. It's something that we support, and the funding is able to provide during the on-the-job training period. This just is, icons again of the participation and the collaboration that it takes to put together an on-the-job training. We know, again, we have the participant who would be the employee. We have you as the employer. We have the business service team here at the Healthcare Sector Center, for example, who would work with you one-on-one and walk you through each of the steps, the pre-award checklist, the on-the-job, the OJT agreement, and support you by answering your questions. I also must say, since we've done this for the last 9 years, there's very little that you're filling out as an employer for the on-the-job training, pre-award checklist and OJT agreement. The pre-award checklist, in a nutshell, it's just asking for your company information. Your tax ID number, who is the contact person, how many employees do you have, for example. Everything else is going to be for you to review and sign. And we're there, the business service team is there to walk you through it one-on-one.
Michelle, there's a quick question.
Sure.
Does the reimbursement cover benefits as well?
The reimbursement is a reimbursement so the answer to that would be no, not directly. The on-the-job training reimbursement is a reimbursement for the agreed upon hours that the individual is working. So an example of that, and thank you for asking, if an employee, they're your employee now, if they earned $20 an hour, what the reimbursement would look like is 50%, depending on their employer size, 50% of that employee's hourly wage. If the agreed upon training period was 600 hours, it would be $10 times 600 hours. That's $6,000 if I did my math correctly. And that reimbursement is coming back in a form of a check to you as the employer. Now, we just ask, and it'll be an agreement that you just be good stewards of the dollar. We're not saying that you have to use it for any specific purpose. It will be just that, a reimbursement check coming back to the employer to reimburse you for as a way to offset your training costs, because that individual may have had a skills gap. And so we're offsetting that training cost.
We have another question from Gabriel Martinez. Could job seekers with U.S. U.S. work permits and limited English language skills be considered for OJT, youth services, and or paid work experience?
As long as individuals have the documentation and the authorizations to work in the United States, and they go through the WIOA eligibility process, once they're part of WIOA, they are eligible for an on-the-job training. In terms of the type of positions, that is the employer. So if an employer has a position that and the individual meets those requirements, whether they are Spanish speaking only or bilingual only, that is what we would look for to meet that employer's needs with filling that position. So that comes from the employer, what type of credentials, skills, et cetera, that an individual has. Anything else?
No,
Thank you for
great
reading the
question.
questions.
No
Yeah, it
problem.
was. I was just going to show here just the training plan. And so we talked about the training plan for the on-the-job training, just so that you have a look at it. Again, this is going to come to you pre-filled. What the business service team members will do is just speak to the trainer, just talk about through having the job description and put together the skills to be acquired based on the position job description and the resume of the employee or trainee. And so we will create the training plan and send it to the trainer or the hiring manager, whichever you deem, for review. So this will be your training plan with your input. It will be training the way that you want to train, not the way that we say it needs to be trained or has to be trained. This will be coming from you with your input, but we'll do the legwork. We'll fill out the information. So this is what this particular slide is showing, just a preview of that training plan. It will also show, for example, the total number of hours in the OJT. So whether it's 360 or 600, and that's determined by different criteria. If it's a CNA, for example, perhaps a CNA would be less hours than a medical assistant who's already had a lot of experience. So that comes through conversation and also using ONET, for example, and other tools that we have to come up with an adjusted and agreed upon hours for which we would reimburse. And you would also see what that reimbursement total would be in this particular column. And again, the business service team would walk you through this.
Mhm. And Brad Allwood has a question. We may cover that coming up. Is there a cap on the amount of funds reimbursed? Usually, they have, as agency, have 20% apprentices per cohort. Also, does the program cover an apprentice outside of Cook County?
I'll let you answer that. Is it about OJT or apprentice?
Well, Brett, did you want to clarify it? It's for a 20 PCT apprentice per cohort.
Yeah, so this is Brent. Yeah, we just call our program PCT Apprentice. But I'm referring to on the job training.
Okay, so thank you for that clarity. Thank you for that clarity. So with on-the-job training, one of the requirements is that the participant should be part of the WIOA program. And right now we represent Chicago Cook Workforce Partnership. So if the participant resides in Cook County, they can be part of this WIOA program. However, it's county. So the other counties also should have WIOA dollars in which they may have on-the-job training too. And for Cook County, we know that extends, of course, in the city proper. And then there's the Southland suburbs, the Northwest suburbs, as far as Schaumburg and Wheeling, Arlington Heights, to the South Harvey. So as long as a participant or an individual is a Cook County resident and is eligible for WIOA, they can participate in the on-the-job training. The location of the employer can be anywhere that employees or participants can get to. Does that help?
Yes, and then I'm just doing a time check. Excuse me, we have about 15 minutes, well,
Okay,
a little bit
I'm
less
gonna
than
move
that.
on.
But also, we have not heard any information about our WIOA grants being cut as of yet. If there is any reduction in funding, we will advise all of our partners in advance. Thank you.
Yes, thank you for adding that. It definitely does depend on those external forces that happen to all of us in the nation. Paid work experience. So this is what I spoke about earlier, WIOA youth, ages 18 to 24. And as Tanya supported and shared, of course, there are different agencies. She spoke about some 73. I think there's probably a bit more within the partnership as well that support different or delegate agencies that support different demographics of participants, if you will. So for our paid work experiences, it's youth 18 to 24. Again, as trainees will have the opportunity to practice and enhance their skills in assisting you in whatever department that you would like, that you would deem. This could be an opportunity for the participant to enhance their resume, to get experience, and for ultimately for you to kind of, gauge whether that is a person that you would want to hire full time. And while this is happening, we are the employer of record. So we're paying that individual as much as $18 an hour, which we have. We've had opportunities to do that with our partner employers. And that can be for up to, again, like I said, 240 hours, anywhere between 6 to 8 weeks, 30 hours a week, a little less. So again, a great opportunity to support youth and also gauge if this is an individual that you want to hire full time, which ideally would be a great opportunity. And just giving examples of the type of work that the paid youth could be doing. In a nutshell.
And I wanted to add, our manager, Kathleen Brannigan, added additional information in reference to the local workforce boards where we can refer and connect people to people outside of the our local workforce area. Lauren Green from CHA asked if, do you have to be a WIOA contracted provider to refer participants for OJT, paid work experience, and or healthcare job placements?
Thank you for that question, Lauren. You do not have to be. You can refer individuals to WIOA. That will be initially through our American Job Centers, and we'll just talk about that a little bit at the end. Our American Job Centers, and through their support, they can be referred to any of the sectors, including the healthcare sector center. So I hope that answers the question, but absolutely. The CCWP network, the partnership, reaches wide, even outside of the agencies under its umbrella. These are just some of the items that we spoke about before on behalf of the work-based learning or internship, if you will. That I've listed here, and this is going to be shared with you. For sake of time, I'll just go to the next slide, which talks about the benefits of the work-based learning programs that Tanya and I are sharing with you today. And again, those include the on-the-job training, the paid work experience, the incumbent worker training, and then rolled up, if you will, into apprenticeship. That's an opportunity. So they can be standalone, or we can help you, support you through apprenticeship as well, from the beginning to the end. Registering, what is a sponsorship, think tanks, filling out paperwork, and I'm speaking about apprenticeships. So benefits here to you as an employer that we can support you with through WIOA funding. Incumbent worker training. Tanya, you want to take this one?
Yes, incumbent worker training, which we refer to as IWT, again, is a work-based learning program, which is a low-cost training solution, as Michelle mentioned, which all rolls up into our apprenticeship programs. They're designed to meet the requirements of the employers to upskill their employees, and it's a layoff aversion project. So this is something where we're providing stackable credentials to prevent layoff and to increase business sustainability. We also assist with building capacity within the company, and the company employees do not have to be WIOA participants to be a part of the incumbent worker training, which means that there's no low income eligibility. You are sponsoring this as an employer training, and the training is conducted with the commitment that this person will be retrained and they will be retained after their training is completed. So you're not laying them off. You have to, oh, April had another question. Do employers have to prove that the workers will be laid off if they do not receive more training? Well, no, because what we're doing is we're upskilling their current staff. So we want to continue on. Many times businesses know if they're in financial ruin that there's going to be an issue, but we're doing that intake on the front end to make sure that this is a sustainable company. So we're safeguarding because we're stewards of taxpayer money. So we want to make sure that everything is fine. The general guidelines is the grant. It is possible for up to 100% of reimbursement costs. The reimbursement costs, the training must be completed and paid before submitting the reimbursement request to the partnership. Usually the per employee is between $1,000 to $10,000 per trainee. There's an employer match depending on the size of the company. We'll be sharing this information with you. And the match goes by company size. Fewer than 50 people, there's a 10% match. Then 100 to 50 to 100 is 25% match, so on and so on. For the course completion, the employer must submit the documentation, which is the invoice, the training provider information, copies of the credentials, proof of the wages that was paid to the trainees and to the employer and to your training staff. And once the information is submitted, the turnaround time for your reimbursement to your business is usually 30 to 60 days for your check to be cut. And we'll gracefully deliver it or mail it to you after that point. It consists of all of the execution that's listed here, what's consisted in the application, and then also the approval and the execution style. So we will provide you with all of that information. We're simplifying the records. We're not trying to give you a whole lot of paperwork to submit, and then we're not giving you multiple people while you're going through this process. We're sticking with you through that process from start to end. Next slide, please.
If I could, I want to share just a real practical example that's happening now with incumbent worker training. We're working with an employer of memory care, and this employer happens to have more than one location, but one location is in DuPage County and one location is in Cook County. Because the incumbent worker training is it goes through an approval process, ultimately leading to the state approval, we're combining both counties into one application for incumbent worker training. With that incumbent worker training, just to talk about, just quickly to share about this matching size. For example, the training for each employee, 48 employees, $1,000 each will be $48,000 that this employer is paying to the trainer to train their employees. However, for these 48 employees, the salaries for these 48 employees will be $60,000, if you will, just using a figure, $60,000. So the employer just has to show us, and amongst other documentation, which will be in the application and agreement, but the employer just has to show us work records that these trainees collectively were paid $60,000 through work records during the training period, and then the employer is going to be reimbursed $48,000. So just wanted to kind of explain that a little bit about the matching.
Thank you, Michelle, for that real life example. I'm curious as to what positions the memory care was training those workers for. And then I know we have less than 10 minutes, so please, everyone on the call, feel free to drop your questions in the chat, and hopefully we can get to all of them before we end.
Sure. So the training is, the employer is memory care, and they have a trainer coming from Spain, if you will. So even the trainer that it's employer led. So they have the trainer coming from Spain, and they have adopted a model for elder care, memory care, where it's called humanitude, where it's touching and feeling, so that they're getting cooperation and they're, a better level of treatment for their residents. So humanitude, forgive me.
I love it.
Tanya?
Also, under talent pipeline management, because you're going to hear a lot of this, that's when we're talking about recruitment and pre-filling and backfilling people or project mapping. But talent pipeline management is the precursor to Apprenticeship Illinois. And that's only meaning that we're building intentional relationships with employer partners such as you, so that we could address our industry partnerships, so that we could work within the realms of industry partnerships. So as you can see, the local workforce board where we sit at the core with the business, and then we bring in all of these partners in so that we could create more of a community holistic approach, including everybody as a convener. And so we can go in as an individual employer, or we can go in as a collaborative, such as how you all are operating today. There is 5 basic steps in the talent pipeline management that builds up to apprenticeship programs. Businesses at the center, there's an industry as a partner. We align with all community partners. We also have a qualified convener, and then we are regionally focused. So that includes our K through 12, our community colleges, our University of Higher Ed. We're looking at the ability to benefit from the community colleges. We're looking at dual enrollment from K through 12, and we're also looking at the Illinois Articulation Agreement through our state universities, so on and so forth. Next slide, please.
Of course.
And as Kathleen Brannigan mentioned about incentives, here is a high-level quick overview, and we will share the information about Apprenticeship Illinois at a glance. We also talk about why we would have apprenticeship programs within our area. Also, there are additional incentives outside of our regular business services to include tax credits. So at the bottom here, these are the tax credits for you as the business for sponsoring an apprenticeship program, an apprentice. So it's $3,500 per apprentice. And then we also have a $1,500 reimbursement from DCO. There's also WOTC credits that we can bring in as well with our partners. And then there's also digital literacy grants that are available through the state of Illinois. Here are all of the benefits for the apprentice, as well as you, the employer, and we'll share this information with April afterwards. Also, here are all of the industry that aligns with Apprenticeship Illinois, and we're being very innovative and really using that I in WIOA. Here is how the apprenticeship will work, which we talked about, all of the on-the-job training and all of our other credentials, etc. And here's the information in terms of how we can get started with meeting with you as a company or a business. Next slide, please. Oh, and then here we go. What our employers are saying about our apprenticeship programs? Here's what they're saying. We're also having podcasts on all of our social media. There's a high demand for apprenticeship programs. So if there's anything that you need from us, please use us as a resource. We're here to build your talent for positions that you have available. And here's additional information about the Workforce Innovation and Opportunities Act. There's information there where we support, and here's information in terms of the eligibility for WIOA, ITAs, and supportive services, etc. Next slide. And our local workforce area is just giving you a quick guide and what our American Job Centers, what they do, what it's about, our delegate agencies, our youth delegate agencies, our sector centers such as Michelle, and our career pathways and training programs. And Michelle?
Yes. And so here we are, the workforce healthcare team, and getting started, next steps. So we don't want to add more to your day. We want to support you and assess your needs and help you figure out how we can support you monetarily, but also through other business services that we offer. And the way to get started with us with interest, with a deeper dive into any of the services that we spoke about, is simply this. You can connect with the healthcare sector team. It's myself and Maria Romero. She's our lead business solutions consultant. We also have 2 other consultants, but Maria and I will facilitate the assessments, if you will, and then do the assignments accordingly. So that is the first step. That is the next step. Contact us, email us that you're interested in 1, 2, and we will do a deeper dive, one-on-one, go as deep as you like, share draft forms with you so you can view them, answer your questions, And most importantly, there are multiple opportunities in the Sector Strategies Toolkit. We've talked about some of them today, and primarily the part that we are here to support you from the beginning to the end. And so looking forward to any interest that you have in speaking with us, and you have our email addresses here. We also, as Tanya talked about, Kathleen Brannigan is on with us today. She's part of the attendees. She is the partnership's business services manager. And so she works directly with healthcare, but also the other sectors as well. So very knowledgeable in networking and answering questions that you may have, and very supportive as well. But this is the first step. Email myself and Maria with any questions that you have and opportunities that you'd like to meet with us one-on-one, virtually, in person.
And
Tanya?
April, thank you for inviting us to present. It's been a pleasure. We're here to assist with any additional information in terms of apprenticeship programs, and use us as a resource, ask questions. Let's build some really wonderful relationships. Thank you.
Thank you so much, Michelle and Tanya. Thank you, Kathleen, for being here and responding to some questions in the chat. I will email this recording and the slide deck to everyone who's registered for this event tomorrow. I'll also, in that email, I'll CC Michelle and Maria at Equus so that you can easily follow up with some specific questions or set up a time to meet with them. And ask about some of your specific programs. I see a lot of opportunities for some of these funds to help maintain some of the Good Jobs Challenge programs that we've been building, or to support some other workforce development programs that I know you all run. Let me know if I can help anyone in doing that. I also wanted to note that we will be doing an apprenticeship event at some point this year. That was the most, everyone recognized that to be the topic that they were most interested in learning about this year. So I'm pulling an event together specifically about apprenticeship, and we'll ask Tanya or others at the partnership to join that as well, to talk a little bit more about the benefits that they can offer in helping you build apprenticeships. And we are at 1
April,
o'clock.
this is Kathleen. I'm going to say quickly, yes, we would like to be a part of that, because a part of that is also the talent pipeline management model that is being nationally facilitated pretty aggressively by the U.S. Chamber of Commerce Foundation. And the state of Illinois is both feet in. There's going to be a lot of money coming out next year for registered apprenticeship programs. Hopefully, yes. That's hopefully. I can't imagine it would not. I'd be surprised. But you know, Tanya's actually a very active. We all went through talent pipeline management training, and Tanya is now a fellow for the U.S. Chamber of Commerce Foundation.
Yes.
And working with other workforce areas to facilitate it. It is employer driven, so this is actually the perfect platform to be facilitating it, and we should definitely incorporate that into, hopefully, into your, you know, the apprenticeship presentation, webinar, whatever you're planning for, April.
Absolutely. I will follow up with you about that, Kathleen and Tanya.
Invite us to the party.
Of course.
We like successes.
The apprenticeship party.
Yes.
Thank you all so very much. Have a great rest of your day. Enjoy the warmer weather this week, and let's hope all of our funding still is there.
Yes.
Yes.
It's been my pleasure, everyone. Professional pleasure to share information with you today.
Yes.
Thank you.
Ditto. Thank you. Have a good day.